fiscal restraint and human impact fueling a debate over proposed changes to Medicaid from Republicans in Congress. 1/3 of New Yorkers are on Medicaid. Congressman Paul Tonko says changes would hit our state hard. Here is CBS 6's Brianna Sapardi.
It's cruelty to so many people across the country.
That's how Democratic Congressman Paul Tonko feels about the big, beautiful bill's proposed changes to Medicaid, highlighting the risks they pose to seniors, low-income families, and people with disabilities.
The outcome now is 14 million people at risk with this bill of losing health care coverage and an impact of $500 billion, a $500 billion impact on Medicare. There's no way you can take those trillions out of health care and not affect great masses of people.
Healthcare providers are concerned the funding cuts could strain hospitals as states struggle to compensate for the loss in federal funds.
Medicaid, Medicare revenue streams are critically important to our hospitals. Many of them in rural areas are concerned that they might have to close.
In 2022, Medicaid eligibility requirements were temporarily suspended due to the pandemic. Some feel these proposed changes simply refocuses the program on those who need it most.
So all this is saying is, look, we need to be responsible fiscally. We need to go ahead and do an eligibility check from 2022.
Scott Speranza's company, HealthLock, helps patients detect billing errors and resolve claim denials. He says many Americans receive erroneous medical bills or are denied claims for no valid reason. And the Medicaid system needs modern checks and balances to make the program sustainable.
We really want people that are able to work, to be able to go get a job if you don't have a child under 7 years old. And then if you make enough money, there are other ways for you to receive your insurance benefits that are very affordable.
We're pleased to have Brianna in the studio with us right now. So, Bri, the question, actually, there's a number of questions, but how far do the GOP cuts go? What are they trying to accomplish here?
Well, the GOP, they want to cut spending by nearly $800 billion over the next 10 years and would do so by tightening eligibility. Now, adults on Medicaid physically able to work must work 80 hours a month to stay eligible. There's also stricter income threshold, which may make it harder for some low-income adults to qualify. I have the full breakdown of those changes on our website, cbs6albany.com.
All right, sounds good. Thank you very much, Bri.